No one is good at their jobs. So if you've been following me on social media lately, you know that my skin has been terrible. I'm wearing a lot of makeup right now, which helps. But when I'm not wearing makeup, I've got these wounds appearing on my eyebrow. I've got all these bumps on my chest, my back, my legs, everywhere. They're not pimples, but they're definitely some sort of inflammation. Which, surprise, I have Crohn's disease, which is inflammation of the gut. And so it's not surprising that this is probably affecting my skin too. Anyway, so I go to this dermatologist who I've been to before, and I say, I have Crohn's. This is probably what's going on. What can we do about it? And he agreed. He said, yeah, Crohn's causes inflammation, and your skin is an organ, and you probably have inflammation in your skin. So I'm going to give you a prescription for this topical cream that's supposed to help with all of these bumps that you're getting. I take the prescription to my local Shoppers Drug Mart. I've been getting my Crohn's medication there since I was diagnosed with Crohn's. So they have my file. I go on to pick it up, and the pharmacist asks me if I've used it before. Nope. Anything I need to know? Well, it'll just really make your skin peel. I go home and I start using it. And I've been using it for about 3 weeks now. Last night, I decided to clean up a little bit, and I still had the package and the paper that came with the medication. Don't know why, but I opened it and started reading it. When you open the instructions, there's a section called About This Medication. And there's a section called When It Should Not Be Used. Do not use this topical gel if you have or have had Crohn's disease. Yeah, the medication that the doctor gave me says do not use if you have Crohn's disease. It literally says do not use if you have Crohn's disease or if you're allergic to the ingredients. There are only 2 reasons not to use it, and I am reason number 1. Not only did a doctor who talked to me about Crohn's disease give me this medication, the pharmacist didn't realize that this medication should not be used if you have Crohn's disease. You literally cannot trust anyone with your medical care. My husband and I talk about this all the time. No one is good at their jobs. Obviously, there are some people that are good at their jobs, like me and him, and I'm sure some of you are too. People are just not paying attention. Maybe it's a little bit of my fault that I didn't read it, but when a pharmacist pulls you aside and talks to you about the medication, when a doctor prescribes you the medication, you really don't think that you have to worry that literally you are the only reason not to use it. As far as I know, nothing has happened to me right now, but who knows? If I hadn't read or I, kept using it, what could have happened to my body? So this is me telling you my story so that you, a Crohn's patient, a colitis patient, someone with an ostomy, someone without an ostomy, anyone who has ever had or will have to take medication in the future. Be your own medical advocate. Ask the questions, read the ingredients, read the little papers that come in the box that we always throw away, and just look out for yourself. You are the only one who can. Thanks, and I'll keep you posted if, my skin starts to fall off. Thanks, guys.